Hi everyone. So today is the second lecture of neurology. In that lecture, I will talk about the pathology of the hemisection of spinal cord, in which we talk about half of the spinal cord. So today our main discussion will be Brown's cord syndrome. In that syndrome, what happened that in that syndrome there is a damage to one half of the spinal cord. If for example this is a spinal cord, right side or left sided, if right spinal cord become affected, if you take a hemisection, if right section become affected, so same side what happen, there is a loss of sensory and motor loss. That's why we call ipsilateral sensory and motor loss. But if you can see, there is a contralateral pain and temperature sensation loss. So that opposite side line shows that there is a pain and temperature loss. So this is the main characteristic of that syndrome. In there is a damage to the half of the spinal cord, maybe due to penetrating injury, or there is ischemia, there is an infection, or inflammatory diseases like tuberculosis. You know, when tuberculosis occur in the spinal cord, we call Pott's disease. What? Pott's disease. And multiple sclerosis, it's also autoimmune disease, or spinal cord tumor that can also cause Brown's cord syndrome. So Brown's cord syndrome, actually it is invented by this scientist we call Charles Edward. So according to his definition, that when the half of the spinal cord become affected, we call Brown's cord syndrome. But out of 100%, 80% of chances that dorsal column will be affected, and 20% whole spinal cord become affected. So this whole spinal cord, very minor cases, half spinal cord become affected, but 20% of cases dorsal column will be affected. Okay, so this is the ascending and descending track. So I'm not going into the detail, I'm just giving you basic concept. There's the ascending track, we take the sensation from the periphery through the dorsal column and they go into the brain. And the descending track, they come from the brain and go into the anterior column, and they go. But here they show just one, but actually ascending track go from dorsal column and the descending track go through the anterior column. Okay, so this is the main picture, this is the main pathology, how this half spinal cord become affected. If you can see in the picture that in the half spinal cord, if that half spinal cord will be affected, so what's the impact on the patient motor system? So upper motor neuron lesion, so lead to the ipsilateral weakness and there is a loss of position as well as vibration. But what's impact, what is that disease affects on other part of the body? There is a loss of pain and temperature sensation. So this is the main pathology, how this syndrome affects spinal cord. See, this is the how Brown's cord syndrome affect the spinal cord. And in that picture they showing that how the left cortex they cross here, because left cortex, left side of the lobe is connected with your the right side of the body, and left cortex to the right body. So left and right fibers, they cross from at the level of brainstem. From here they crossing each other, and then they go there a contralateral body sided. So that's all about the Brown's cord syndrome. So I hope so you understand. In a summary, what is that disease? In a short way, that disease affects the spinal cord hemisectionally. So in that disease, so patient give you very confusing clinical pictures. So patient say that, doctor, I have one-sided I have one-sided motor weakness, but in opposite side I'm not aware of the temperature. So that's how that disease present in the patient body. And then I already told you what's the causes. Causes can be ischemia, causes can be infection, causes can be inflammatory diseases like tuberculosis, multiple sclerosis, and spinal cord tumor. So this is how that disease affects our half spinal cord. So that's all. Thank you so much.